Great advocacy always begins with passion, without a doubt. So every single person at the Academy has that element, and that's what really makes it a special place and a unique place to be. What they don't always have is skill sets, and being a great advocate means that you need to be able to push what we can always chance is evidence-based advocacy. It's our mantra, and we're really trying to help people that have the passion and have the experience in a cancer patient setting, or either as a caregiver or as a person who's been affected directly by cancer, and train them to effectively, based on evidence, reflect their opinions and their perspectives so it can be integrated well into medical policy and decision making. And this is something that's not an easy and obvious task. Some of these people are recently diagnosed and have just been confronted with a terrible life-changing message. And so they're dealing with many things at once. Some of them are representing small groups in different countries, maybe at a national level, even local, regional level. And they may be primarily in peer-to-peer support and helping the patients come to grips with it. Other ones are more advanced in looking at things like European policy issues, like health data, which was something we just talked about, or other types of issues, gathering data and so forth. So we have a huge range, and that's normal for patient advocacy. You really do have a kind of an evolution along a line where you have small groups beginning who develop and eventually accelerate and become professional advocates. And we're just here to support people in whatever their objectives are. Maybe they want to improve their peer-to-peer support programs. Maybe they want to learn more about health policy. Maybe they want to learn about how to run a survey and effectively use that. So there's lots of reasons why we're here, but because this program is so incredibly diverse and the participants are also so incredibly diverse, the way we've gone about building this program is pretty unique, and that we start, as part of the program committee here, we start by something called Smart Start. This is really the basic forms. What can the beginners learn from this? How can we help them professionalize their craft? And then we add on complexities session by session, essentially. Now, this last day we're on now, day 4, is really for the truly advanced, where we're talking about in-depth policy issues having to do with Europe, European vision, how can we affect things at a continental level. So there's everything from real basics, how do you get funding, how do you start your group, to how do you have a global impact with your organization. And WECAN is trying to embrace that entire mission and vision, and that's challenging, and that's why the program we've built out every day is more complex, is more advanced, and people can start when they need to and stop when they need to. So some people skip the first day because it's too easy for them. Some people skip the last 2 days because it's too difficult for them, and that's the beauty of it. Is it's meant to serve everyone in the way they need.